This segment is sponsored by Oklahoma Proton Center. Joining us now is Dr. Mark Story with the Oklahoma Proton Center.
And November is Lung Cancer Awareness Month, so we want to know about the benefits of proton therapy for lung cancer patients.
Yeah, thank you very much for having me. I mean, this is such an important month. Unfortunately, lung cancer is really a tough disease. It's the largest killer of cancer patients in the United States. And so we need to do things to push things forward. And then really that's where myself and Dr. Chang are so excited about proton therapy. Really the goal of protons is to try and reduce the amount of normal tissues that we treat when we treat a lung cancer. So our goal is to treat less of the esophagus, less of the lungs, and less of the heart to allow patients to improve their tolerance of treatment so that they can not only focus on the cancer treatment but have a great quality of life while they go through their treatment.
And there's been some new clinical data released showing some benefits of proton therapy for lung cancer patients. Let's talk about that.
Yeah, absolutely. It's a very exciting time. 2018, 2019 has been a great couple of years. We've had a very important trial looking at patients treated either with protons or with IMRT when they were giving chemotherapy at the same time. And the patients that were treated with protons went in the hospital about 1/3 the rate of the patients who were treated with more traditional treatments. There's additional studies that just came out within the last 2 months saying that radiation treatment to the chest causes heart disease. And so things that we can do to reduce dose to the heart have great potential to reduce heart disease. I think on the positive note, if you look at where we are today with the treatment of lung cancer, patients who receive chemotherapy and radiation together today live about twice as long as those patients treated just 10 years ago when they received chemotherapy first and radiation second.
Wow, that's such good research and awareness that we have now. When should a lung cancer patient start to consider proton therapy?
Yeah, we really like to see them early in the treatment process. The unfortunate reality is about 250,000 patients will be diagnosed with lung cancer this year. And some of those cases are very difficult, and I think if we see them early, we can have a larger impact and help them to improve their survival in the long run. The first treatment option, the first time we try and treat a cancer, it's really our best option to get rid of it. And so we like to see those patients early and give input and help with a multidisciplinary approach using all different aspects of cancer care specialists to work together to formulate the best plan for those patients.
And what is the treatment process like?
Yeah, I think the most important thing that we do differently is we try and determine if you're a good candidate for protons. So the first step is for us to review your record and your specifics and see your imaging and see you in the clinic and decide whether or not protons are of benefit. And really the main way we do that is by doing comparative plans. So we look at a proton plan and we compare that for your case to an IMRT plan and see if there's a reduction in the dose to the lung or heart. If there's not, then it doesn't make much sense to be at the Proton Center. But for many patients, there's a significant reduction in the amount of normal tissues that we treat, and those patients, I think, can really benefit from the addition of protons to their overall course.
Any other resources for patients out there?
You know, I really like to talk about preventative actions, right? So even out of the 250,000 patients that will be diagnosed, about 20% do not have a smoking history. I think that's important to know. So it's not just a disease of smokers. And then the second thing is if you have a significant smoking history, there are great trials and resources available for you to have CT scans to try and catch the cancer earlier. The earlier we catch the cancer, the better we can do and the more options we have available. So if you have a significant smoking history, I'd encourage you to talk to your specialist across the region. We have great care teams, not just at the Proton Center, but across the region. Talk to your primary care doctor, talk to your physicians, and see if a low-dose screening CT scan makes sense for you.
Okay, Dr. Story, thank you so much. We certainly appreciate it. Oklahoma Proton Center is located at 901 West Memorial Road in Oklahoma City. You can find them online at okcproton.com or give them a call at 405-773-6700.